there's hardly anything more satisfying than boldly stepping in and finding our own healing and helping others with the same. Karl Humiston, MD, psychiatrist, holistic medicine, retired from that in my 60s, and now, ever since then, I'm 88 now, I'm still working as a Rolfer, restoring people to their original organization. I remember I was 37 years old, spent an intensive week training with Virginia Satir, and realized all these wonderful things I was learning to help my patients. I needed all of those things just as much as they did, which is a rare awareness for a psychiatrist. Fritz Perls' approach to psychiatric difficulties was that talking about feelings instead of experiencing them is like talking about food instead of eating it. That's my words. He didn't say that, but I mean, I came up with that as a nice way to encapsulate it. And he respected my grasp of his work. In fact, shortly before he died, he asked me to leave what I was doing and become his full-time senior associate. And I said yes, and then he died, so it didn't happen. But people would talk about the terrible thing that happened at work or the difficulty with family. And he would say, be there now. What do you feel? Talk to her. Put her in the other chair. Talk to her. What do you say to her? Okay, tell her about the problem. Okay, now switch chairs. Be her. What do you say to him? And see, that kind of thing doesn't come from thinking, it comes from here. A couple would come in having conflict, married couple. So in that first session, I would ask them about it, and instead of doing the psychiatric thing, tell me what's wrong, what's the problem, I would reframe it as Virginia taught us, and I would say, tell me what you would like to see different. Oh, you see, that puts a whole different slant on it. And tell me what you would like to see different. Or maybe she comes in alone and she says, I can't stand living with that man. Oh, do you mean you want to divorce him? Oh, no, I don't want to divorce him. Do you mean that you don't know how to make it work to live well with him? That's right. Do you mean in order to stay with him, you really want to learn different ways of being with him that would work? Yes. In 2 minutes, what a change. And so now she's ready for some training. Have them sit facing each other. And I'd say, look at each other's eyes. And while you're doing that, notice the feeling that comes into your body. Now, while you're still looking at each other, talk to each other about the problems you just told me about. And they'd start talking about, and the instant they started talking about the problems, their eyes would look away. They'd lose that connection. The moment they focused on the problem, the connection was lost. And of course, now they're aware that that's what happened. They had a nice connection, but the moment they focus on the problem, it's lost. And then they come back for the next session 3 weeks later and they say, oh, things are so much better since we saw you. Once you catch on to what heals, what connects, what restores, it doesn't take long to help people get better. Still working at the state hospital just before I went to my Rolf training. When I was learning these things, and I was clinical, and I was director of training, but I was also clinical director of a 160-bed unit, 4 40-bed wards. And the staff came to me saying, Mr. So-and-so is starting to get manic again, wild, and expecting that I would write an order for increased medication, as the other doctors would. I said to them, take off his shoes and socks. They did, and he quieted down. He was grounded in his body. That tickled me pink. I thought, yeah, yeah.